Just this Saturday, Rwanda registered 284 new COVID-19 infections, figures that were last seen about 5 months ago. Among these infections, 75 were from Rubavu district, something residents say stems from the consequences of the eruption of the Nyiragongo volcano in the DRC. Health Minister Dr. Daniel Ngamije also emphasizes that the claims of these residents are justified, as he further explains the cause of the increase in infections across the country.
We have in the region increase of cases in some countries and neighboring to Rwanda. Therefore, some movement of people from those countries, we noted those movements. People are coming either on road, by foot, or coming with the airlines. And we tested those people and we found that some of them were positive, a certain high level of incidence among those groups. We have also a recent event which happened in DRC, where we have a cross-border movement of people coming and going, coming again. Among people that we are testing in Rubavu, we found that a good number of them were positive. But also, in general, people are also relaxing regarding preventive measure for COVID. We noted beginning of May that social gatherings that are not allowed, especially in families. There are a lot of parties in families, and you can imagine those kind of parties, there is no social distancing, there is no wearing of mask. People are just, if one is infected, the transmission to everybody who is there is likely to be happening. So in schools also, in some schools, we noted that some kids were infected in some companies. In general, you can see that people tried to relax for no reason, because the disease is still there.
This is among the reasons a cabinet meeting was held on Saturday, where it was resolved to suspend parties and events, with events such as traditional weddings only hosting 30% of the capacity venue, with a negative COVID-19 test required 3 days prior to the event. The Minister of Trade and Industry, Honorable Beata Uwamariza Habyarimana, says the measures put in place are aimed at preventing the spread of the pandemic while reviving the economy as well, which is why all Rwandans, and especially traders and business people, should make it their own initiative to avoid complacency.
I think that we need from the business owners to see their participation in this battle. It is not just the duties of the security organs or the Ministry of Health or local administration organs, but really everyone has his part in this in fighting this pandemic. And we think that in one side it goes to the business owners, to the employers, to make sure that their employees in their businesses are really applying the measures. But in the same time, we also invite them to have more regular testing with the employees, so that they can make sure that even though those who are waiters or who are just serving, they are safe. This also increases the reputation of the place. But we also think that in these common places like markets, shops, starting from really the Mudugudu stage to the high-level restaurants or hotels, they have to put in place those measures of washing hands, applying the social distancing, and even having youth volunteers to assist them, so that if they keep those measures, complying with them, it will sustain the recovery of the economy. But if they fail to do so, they're like pushing us to have more strict measures, what you don't want to have currently. We really believe, and we're like betting on them to own these measures and to put them in place, so that we both together work together to have that economy recovering.
The Minister for Local Government, Gatabazi Jean-Marie Vianney, also warns those that are still going against COVID-19 preventive measures, especially for the activities that are still not allowed to operate.
Local authorities are working together with security organs, and we are going to put in more effort to do a follow-up in every cell settlement where bars are opening within people's homes. We have arrested some, but not all of them. We are working with the police as well to see that this can be addressed too, together with local authorities, youth volunteers who will update us where these illegal activities are.
Currently, almost 400,000 people have been vaccinated against COVID-19, a small percentage compared to Rwanda's goal. This is while there's been a surge in infections across some countries on the continent, what scientists are calling a third wave. Dr. Daniel Ngamije says Rwanda could still avoid the third wave, but only if stringent measures are taken and adhered to.
There is a trend that there is a tendency of increasing disease incidence in the region, even in other parts of the world. But all depend the way we will comply with the measures, because we are taking this strong decision, hard decision, where we have only an incidence of almost 15 for 100,000 people, which is still, let's say, at the level where we can really contain the disease. Remember that last year in August, we reached up to 75 for 100,000 people, and in August, but we could manage to reverse the situation and bring down the incidence. So it's feasible. We need to comply, and if everybody decide to really be an actor for this disease rather than being in passive mode.
For life to return to normalcy, 60% of the population needs to be vaccinated to reduce the infection rate and mortality.